Good afternoon. This is Matt Doyle. I'm President and CEO here at Methodist Hospitals. I welcome you today to our 2022 Annual Public Forum, where we'll be reviewing the past year of service and some key initiatives that we have coming up in both 2022 and 2023. At the end of this session today, I'll be pleased to take any questions that you might have. Thank you. And thank you for your support of Methodist Hospitals. As we go through the presentation today, I always want to ensure that we remind our listeners as to what our mission, vision, and values are at Methodist Hospitals. Our mission at Methodist Hospitals is we exist to provide compassionate, quality healthcare services to all those in need. Our vision is to be the best place for employees to work, the best place for patients to receive care, and the best place for our physicians to practice medicine. We have 6 core pillars that stand up our mission and vision. They are safety, quality, the patient experience, relationships, growth, and financial stewardship. The foundation of all of that are our values. At Methodist Hospitals, we are an eye care organization. Eye care stands for integrity, compassion, accountability, respect, and excellence. Methodist Hospitals is comprised of 3 campuses. We have our North Lake campus located in Gary, Indiana, our South Lake campus located in Maryville, Indiana, and our Mid Lake campus, which is located in between those 2 locations. We also have 4 Care First immediate care locations. Those are throughout the region, located in Crown Point, Valparaiso, Maryville, and Cherville. Methodist Hospitals has over 500 physicians and allied health professionals on our medical staff, and we employ approximately 2,500 employees at our organization. At Methodist Hospitals, we're very proud to be selected by the Post-Tribune Neighbor's Choice Awards in 2022. Methodist has a very important birthday coming up. We will be 100 years as we embark on 2023. This is an actual picture of the groundbreaking that occurred in 1923. Methodist Hospitals is extremely proud of 100 years of service to Northwest Indiana, and extremely proud of 100 years of service to Gary, Maryville, and our other service areas. Another item that we're extremely proud of is our service during the COVID-19 pandemic. We're now embarking on our 3rd year under emergency response for COVID-19. Some important components of what our response is to the community. One, I think, is providing accurate information around the virus, ensuring that the public is updated with current information. And with that, we want to make sure that everybody has availability to the extremely important vaccines. Methodist began back on December 16th of 2020 providing its first vaccines. We've now provided more than 100,000 doses. Again, these are going to our community members here in Northwest Indiana. We continue to provide the very important boosters. We're doing those at a multitude of vaccination sites. We have 6 vaccination sites. We utilize North Lake campus, our North Lake outpatient pharmacy. We utilize our South Lake campus here in Maryville for different pop-up locations. And we're utilizing our 4 Care First immediate care centers to provide ongoing support, again, for these very important vaccine boosters. An important item for me to talk about is the support of our healthcare heroes, the folks that work at Methodist. This has been a long haul. We've had a number of new surges that we've had to weather. Throughout that, we've worked to maintain and support what the community's needs are. We have faced challenges of caring for both COVID and non-COVID patients through our healthcare system. And again, we've tried to maintain the important morale and support to our team members. We need the community to also assist and provide that support as we go forward. There will be new challenges in the upcoming year, and we look at partnering with our community to be successful through those challenges. Where are we at today? Well, I'm very happy to report that we've seen a significant decrease in inpatient activity related to COVID. We average between 10 and 20 COVID inpatients on a daily basis. That is a very manageable number for our healthcare system. As you've heard, the variants that are still out there, BA4 and BA5, have been a challenge in the healthcare environment. They're highly contagious variants, and that's why, again, it's so important for folks to consider the vaccine booster that's available. We are continuing to look for opportunities to push higher vaccination rates within our communities. We will partner with other organizations to try to increase access or availability either to the citizens in our community or to the vaccinations themselves. Throughout this, labor and staffing have been a challenge. I encourage all of you that are listening to do a couple of things. One, be very supportive to the folks working in healthcare, and also encourage others who might be considering a career in healthcare to look at that opportunity. We have been functioning in our, quote, new normal, and we've become very accustomed to managing both COVID and non-COVID activity. I want you to understand that our organization is prepared to deal with whatever circumstances come. I want you to feel confident that our organization is ready to deal with whatever challenges come next. Let's talk about Methodist hospitals and its impact that we have on the community, especially from a financial standpoint. In 2021, we had over 207,000 patient encounters. That's comprised of 125,000 outpatient visits, about 62,000 emergency room visits, over 12,000 inpatient admissions, almost 5,000 outpatient surgical cases, about 2,000 inpatient surgical cases, and over 1,000 newborn deliveries. This equates to over 207,000 total patient encounters. So that's the direct impact that we have on the community, and that's providing those important healthcare services to all of those in need. Next topic I want to talk about is the important financial dynamic that Methodist plays in the community. Our healthcare system generated almost $420 million of net revenue. At the same time, we had almost $367 million in operating expense. Of that operating expense, over $200 million equates to employee salaries and benefits. Those go directly to members of our community. We purchased over $160 million of purchased goods and services. This resulted in approximately a $25 million EBITDA. EBITDA stands for earnings before interest, depreciation, and amortization. This allows us to reinvest back into our facilities, important technology, and to provide additional dollars for services and labor needed. This was a strong year in 2021 for Methodist, and it was a great year to be able to put dollars back into our community. Let's talk about that impact. Those dollars going back into the community, they have a compounding impact. As you can see here, We estimate that we produced almost $907 million of annual impact into the local economy, again comprised of dollars through wages for our team members, impact of goods and services provided back into the community, the spending that we did building and equipment throughout the year, and then the very important components of charity care, again, that we provide to our community. To sum up again, in 2021, Methodist hospitals had an economic impact in the community of almost $907 million. Here at Methodist, we're committed to being transparent and to remain affordable. We have financial assistance programs, and we want to make sure that the public and the community understand those programs. We have two ways to help you get covered under HIP 2.0. We have walk-in Wednesdays, where you can come into our North or South Lake campus and work with one of our team members to get signed up. You can also do it by appointment. You can arrange a personal consultation at either, again, our North Lake or South Lake campus. There's some important supporting documents to ensure that we've got proof of residency, proof of U.S. citizenship, and proof of household income. With that information, you can work with our navigators to see if there's an opportunity for additional coverage under HIP 2.0. We have a partnership to assist with Medicaid enrollment, and we have important grant programs such as No Women Left Behind and our Bears Care program that subsidize important annual mammograms. These programs, again, are all designed to provide financial assistance to our community and to try to keep healthcare as affordable as possible. Transparency is our priority. We need to make sure that the community understands your healthcare, and we need to make sure that we provide information so that everyone can make informed decisions about their care. Please visit our website to view prices for common services. You can click on Price Transparency at that site. Ask us for an estimate. We have an estimate tool in the Price Transparency page on the website. And visit mycareinsite.org, where you can compare hospital charges and quality ratings to others. As always, be sure to contact your insurance company to learn exactly what you will pay out of pocket based on your insurance. As mentioned earlier, Methodist is committed to trying to keep healthcare as affordable as possible. We have to look for ways to continue to be more efficient and therefore reducing costs. We're actively engaging in a number of efforts. We've got initiatives to improve the quality of care, reducing hospital-acquired conditions. This, in effect, will reduce cost. We are committed to improving our CMS value-based purchasing performance. Again, the better performance that we have will produce lower costs. We're constantly looking for opportunities to reduce the cost of medical equipment and supplies used in patient care. And we have to be aggressive in negotiating with our insurers to obtain better pricing on drugs and procedures. We do offer a discounted medication price program in our outpatient pharmacy. We do this through the very important 340B drug savings program. Hospitals face many challenges. And here in the state of Indiana, we've got a lot of opportunity. There's a disconnect between our business community and our health community. In business, within Indiana, the state does very, very well. Cost of doing business, state infrastructure, and state regulatory environment all rank as number 1. Ranks number 5 in a property tax index, and number 9 in state tax climate. That is a very successful set of rankings for the business community. Within our healthcare community, we are not faring as well. Indiana ranks 48th in public health funding. We rank 41st in percentage of smokers. We rank 36th in infant mortality. We rank 43rd in cancer deaths. And we rank 36th in overall health, as rated by America's Health Rankings in the 2020 report. I would say this presents a great opportunity for the healthcare community within Indiana. We need our state, our local leaders, our healthcare leaders, and our community to come together to improve these rankings. One of the challenges we have in improving those rankings, quite frankly, is reimbursement to the healthcare community. Based on statistics, Medicaid only pays for about 23 cents on the dollar when you compare it to what the hospital's cost of care is for that patient. Medicare pays about 87 cents on the dollar, again based on the hospital's cost of care for that patient. We need to increase the reimbursement that comes to the hospitals. There's a program within Indiana that the hospital supports, and the hospitals pay in about $800 million annually to increase that low Medicaid rate. Another important statistic is the fact that approximately 43% of all Indiana births are birthed to Medicaid beneficiaries. We need to improve the payer situations in regards to healthcare. Methodist does have a heavy reliance on these government payers. Methodist is considered a safety net healthcare system, and the reason for that, again, is we have about 84% of our reimbursement coming from government payers, which I just pointed out pay significantly less than the cost of care itself. As you can see by this chart, there's a significant difference as we look at Methodist hospitals and urban hospitals, which are very comparable, when we push them up against suburban facilities. You can see urban hospitals have approximately 86% of the reimbursement coming from government payers, where suburban hospitals have 43% of their dollars coming from government payers. This creates a significant imbalance in the reimbursement between urban and suburban facilities. Methodist Hospitals has approximately 10% commercial insurance. As you can see, that's comparable to other urban hospitals. The difference again coming where suburban hospitals have approximately 51% commercial insurance. Again, we must improve payer relations with safety net organizations. Of the dollars that are brought in, I just want to do a quick breakdown of where that spend goes. We talked about the important employee wages and benefits earlier in the discussion. Statistically, I wanted to let you know that about 60% of all of our operating expense goes into employee wages and benefits. So again, these are dollars going directly back into the community. You can see we also have other services at just under 20% and other products at just over 14%. These are all dollars that contribute to that economic impact within our own community. You can see a fast rising area of our expense is in prescription drugs. Makes up almost 7% of our spend, and that number has increased at a rate of 18.5% when we go back and look at year over year from 2015 to 2017. So it is increasing at a much faster rate than medical inflation. Hospital systems are a significant contributor to Indiana's economic health. Statewide, we look at direct and indirect impact. Payroll, or wages and benefits that I just discussed, are almost $26 billion in the state of Indiana. Supply purchases are just over $18 billion. And the capital spend on facilities and technology for healthcare systems in Indiana is closing in on $4 billion. So overall, healthcare entities are contributing an impact of over $48 billion to the state of Indiana. We are major employers and purchasers of goods and services, have almost 250,000 jobs in Indiana, and we employ 113,000 employees. So the additional jobs created are folks who are working to support healthcare facilities. As you can see by this data, healthcare systems are extremely important to the economic health of the state. I'd like to transition to some recent accomplishments here at Methodist. This past year, we had some important accomplishments when we look at accreditations. We completed our inpatient and outpatient CARF accreditation. This is for our rehab unit, both inpatient and outpatient, and is the gold standard of providing rehab care. Also, we've just completed our CAP accreditation. This is the gold standard within laboratory services. We've received national accreditation through the NAPBC for our breast care center. In this past year, we received a new accreditation around our bariatric surgical program, again receiving the absolute highest standard in bariatrics. I'm extremely proud of our organization and the accomplishments through 2022, and we look forward to continuing those and adding new accomplishments in 2023. Some additional accomplishments in 2022 were focused around our strategic service lines. Our Neuroscience Institute was designated as ACHC, Thrombectomy Ready Stroke Center. Methodist launched our Hematology and Oncology Institute and Infusion Center in 2022. We also added Neonatology Navigator and formed a number of new programs with the intent on reducing maternal and infant mortality. As already mentioned, our bariatric surgical program was designated as a comprehensive center by MPSA QIP. Our Heart and Vascular Institute expanded our open heart cardiothoracic surgical program in partnership with the University of Chicago, and we added a number of new physicians throughout the year. Excited to announce we hired a new endocrinologist, a new spine surgeon, and a number of new family practice physicians. When we look at technology, I want to go back and talk through some of the accomplishments again in 2022 related to technology. We expanded our robotics surgical program in partnership with Da Vinci. We did over 130 cases in 2022. We brought in new upgraded imaging equipment, new digital radiology equipment throughout the healthcare system, and added additional 3D mammography to our already highly accomplished breast care center. We purchased a robotic Monarch device that will assist in early lung cancer diagnosis. We began a remote patient monitoring program in partnership with our new endocrinologist. We went live on Epic Anesthesia, again ensuring that we have automation in partnership with our clinical areas and our electronic medical record. And we put in new telemetry devices throughout both campuses. We had a number of accomplishments in 2022 related to facilities. We expanded into the Valparaiso market with our Care First Immediate Care Center opening. We had a newly renovated neuroscience clinic. We built out new GI and cardiology clinics. We're moving our South Lake outpatient therapy area to our Pavilion A, which will be adjacent to our Ortho Spine Center, allowing for a great continuity of care. We're making significant upgrades to our Pavilion C location in the lobby area, and we completed work early in the year on our long-term strategic plan. Some key outcomes from that strategic plan. We have 4 critical success factors. We must build an effective, aligned medical staff and employed physician group. We must achieve key quality, safety, and patient experience performance targets. We must find ways to grow within the market and to become the preferred provider within Northwest Indiana. And we must achieve the financial targets that we have out there so that we can fund those facility, technology, and service and staff investments we've spoken about. So with that strategic plan and all that activity going on, what's next? We've got some tremendous plans right in front of us. We're looking to add an interventional radiology suite in partnership with the University of Chicago. We're going to be replacing a cath lab at both our North Lake and South Lake campuses. We're partnering with Epic to do an Epic refuel project throughout our healthcare systems by leveraging our clinicians and the efficiency of our electronic medical record. We're going to be opening a Methodist Mart at each of our locations, both North Lake and South Lake. They are going to go into what was formerly our gift shop locations and will provide a convenient 24-hour service. We're going to create and finish our outpatient pharmacy at our South Lake campus. We are in the final planning stages of a family practice residency in partnership with IU Northwest, and we have exciting plans to partner with University of Chicago in a number of strategic service lines. So as we move forward, what are those critical success factors? Again, we've got to continue to expand the Methodist brand into all local markets. We must improve our brand image. That comes from a laser focus on quality, safety, employee engagement, and patient experience. And we have to continue that strong growth in strategic service lines with a focus on new technology and high-quality providers. I look forward to our second century of healing and service together. Thank you so much for listening today. I hope you found it very informative. I'll be happy to take any questions that you might have. This brings us to the end of our presentation today. Thank you so much for taking the time to learn a little more about Methodist hospitals.